Welcome back to the Hampton Roads Show. Did the big game eating and drinking on Sunday make for some heartburn on Monday? But when is that heartburn a sign of bigger problems? And what can you do for relief? Dr. Ron Post from TPMG General Surgery and Reflux Center joins us now with some answers. Dr. Post, welcome to the Hampton Roads Show.
Thanks for having me.
Okay, so first let's talk right away. Let's get it right out of the way. What is reflux?
Well, reflux or gastroesophageal reflux disease, it's a very common problem, and in some patients it can be very debilitating. 20% of people in this country have it. 60 million patients suffer with at least monthly. 50 million have it at least once a day that requires some kind of treatment above and beyond just dietary. The problem is with the lower esophageal sphincter. What that is, in layman's term, it's a circular band of muscle around the lower end of the esophagus, the tube that connects the mouth down to the stomach. What's supposed to happen, how it's supposed to work, is when you eat, you swallow food, it goes through the esophagus, goes through the sphincter. The job is to relax, allow that food to go through and into the stomach. And then the sphincter is supposed to close and keep that food and the acidity in the stomach where it's supposed to be, where it's tolerated and out of the esophagus. In patients with reflux, it doesn't do that job. It's weak, and it allows those gastric contents to get back up into the esophagus and cause irritation, sometimes inflammation. And the real problem arises when it's left untreated. It can actually cause precancerous and cancerous changes. And that's the real concern with reflux patients that you don't think about. Oh, cancer can happen with reflux. It can if left untreated long enough.
Is there a difference between heartburn and reflux?
They're kind of exchangeable. It really is a matter of, is it a nuisance or is it something that needs treatment?
Right. So you gave us sort of the symptoms. If somebody, what's the difference people might know between heartburn and reflux, and what should they? I mean, obviously they know they're uncomfortable. There's discomfort. There's burning. What? Typical
symptoms are going to be the ones you think of typically: heartburn, indigestion. It can progress to where you have swallowing problems, where if there's damage done to the esophagus itself, you can have problems processing food from here to there. It can get to the point where you're bloated, you have nighttime regurgitation if it's bad enough, because at night gravity is not your friend. It allows that gastric juice to get up into your esophagus a little bit more easily. You can get this acidic taste in the back of your mouth in the morning. And it can get so bad where you develop a chronic cough, or if you already have a cough, asthmatics, you can get exacerbations of those symptoms. And it can get so bad that you're actually regurgitating undigested food during the daytime, or certainly in the morning once you wake up from a full night's sleep on your back.
Let's talk about non-surgical remedies. What can you do without surgery?
Yeah, as much as I like to operate, and I do, most patients will not see the inside of an operating room.
Good.
You start with lifestyle changes.
Right.
You start with, if you are overweight, weight equals pressure, and pressure is pushing that gastric juice back up into the esophagus where it's not supposed to be. A healthy weight loss program, we're going to recommend that.
Right.
If you smoke, tobacco products have nicotine, and that has an effect on that lower esophageal sphincter. Smoking cessation, we're going to recommend that as well. And then in terms of what you eat and how you eat, instead of 3 big meals a day, we're going to recommend, let's have maybe 4 or 5 smaller and more frequent meals. Chew your food up thoroughly. If you can identify certain trigger foods, like if I eat that really stirs things up. And sometimes it's spicy foods, fatty foods, caffeinated for some people, carbonated, chocolate, alcohol. If you can identify that food sets it off, I'm going to minimize that. And then there's positional. At night you can get to elevating the head of bed, sleeping on your left side. And if all that is not working for you, that's when you start to get into medical management, and that's when my GI friends get involved and usually help me with some diagnostic tests like upper endoscopy to look at it and see what degree of inflammation is going on. Make sure nothing else is going on by biopsying and making sure none of those precancerous changes are there.
We don't have much time, but let me just ask you, if the lifestyle changes don't work for you, how invasive is the surgery, and how well does it work?
Well, 2 common procedures. One is a fundoplication, done minimally invasive laparoscopically, where we take the top part of the stomach and wrap it around the esophagus, block the amount of acidity that can get up into the esophagus. And then the newer one, when I say new, it's been FDA approved since 2012, is the LINX device, where we place a magnetic necklace around where the lower esophageal sphincter should be doing its job, and it allows food to pass through, but then the magnetism between those beads closes down and keeps the acidity in the stomach where it's tolerated.
Patients are seeing relief from that?
Thousands of patients have had the procedure, many more with fundoplication, but yeah, long-term relief is expected.
Yeah.
And it's an outpatient procedure, both of them done laparoscopically, minimally invasive, small incisions.
Well, thank you so much for sharing that information. If you want to find
bet.
out more about Dr. Ron Post, he can help you on with reflux signs, symptoms, and treatment. Get in touch with Dr. Ron Post at TPMG General Surgery of Suffolk and TPMG General Surgery and Reflux Center in Newport News. You can call 757-673-6118 or visit mytpmg.com.